Health is a state of complete emotional and physical well-being. This also involves financial health, which contributes to the overall health. The people with better financial health, for example, may worry less about finances and have the means to buy fresh food more regularly. Those with good spiritual health may feel a sense of calm and purpose that fuels good mental health. Many desire to embrace healthy living to improve their overall quality of life. In a defined state of enhanced well-being, the realization of the fullest potential of an individual, physically, psychologically, socially, and economically, and further, the fulfillment of one's roles and expectations in the family, community, and other setting experiences wellness of an individual. The World Health Organization is a specialized agency of the United Nations responsible for international public health and also advocating for universal health care, monitoring public health risk, coordinating responses to health emergencies, and promoting human health and well-being. However, the strike of the unprecedented respiratory communicable disease COVID-19, whose genesis was in Wuhan City, Hubei Province, China, posed a great threat to the human health and being declared a global pandemic by the World Health Organization on March 11, 2020. The virus has spread across the continent to over 180 countries, claiming lives of over 4 million people globally. This has deteriorated the day-to-day activities of various individuals across the affected nations. The outbreak did not spare Kenya, as citizen of this nation was thrown to an unprecedented moment when the first outbreak was reported on 13th March 2020 in the country's capital city, Nairobi.
Fellow Kenyans, I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya. The case was confirmed on the 12th, which was last night, as the first one to be reported in Kenya since the beginning of the outbreak in China.
This left Kenyans with a myriad of unanswered questions on the government positions to protect its citizens from such a deadly virus. Following the outbreak of COVID-19 in the country, various sectors have been adversely affected and many have been off due to nature of work. The country has witnessed job cuts across various sectors, and incomes of businesses and available working hours for staff have fallen significantly. The number of cases of COVID-19 in Kenya has risen rapidly from the first reported case on 13th March 2020 to date, with the highest number of reported infections and deaths compared to its neighboring countries. The impact and the rate of spread of infectious disease may be linked to the inflamed by the huge number of people living in poverty, a weak health infrastructure, overcrowding in informal settlements, and poor access to basic services such as clean water, sanitation, and hygiene. To step in to curb the spread of the virus across the nation, the government has laid out in place various measures, including limiting movement in places with reported cases, closure of public spaces with high human traffic, such as schools and public events, dusk to dawn curfews, and ensuring basic hygiene and social distancing. And how does this cautionary measure help to curb the virus? Are they being adhered to?
I'm a public health expert as well as public policy expert. The issue of COVID-19 is a convoluted idea. It's an issue that calls for much insight. Yes, I can agree that the cautionary measures, like the issue of mask, has really helped the spread. We have social distance, and has really helped. Washing hands. Hand washing has not only helped to curb the spread of COVID-19, but also it has enhanced hygiene.
However, these precautionary measures continue to have negative economic impact on business and workers. This nature of spread, shocks and disruptions are likely to be felt both in short and medium term, which pushed the government to establish the National Coordination Committee on the response to the coronavirus pandemic to assess the impact of the virus and come up with various feasible recommendations for the economy.
People have felt corona more than anything else because they have lost their livelihood, they have lost their jobs all over. And we can say government has come up with some feasible measures to curb it. But in my view, yes, the government has come up with the most feasible measure that the government has come up with is vaccination.
Public Health Officer Mr. Boniface Butichi notes some of the critical issues of the economic impacts of COVID-19 on housing, transport, food security, and the labor force in Kenya, and some of the measures brought into effect by the government across the COVID-19 prone areas and their impacts on the lives of the Kenyans, particularly people living in the low income and the most vulnerable.
People living in our low income areas, especially our slums, those people have nothing to lose other than their life, which they have never even taken care of. They are even more than willing to lose their life because even the kind of life they live, they do not appreciate it. So if you move around the slums, you will realize that issues like handshaking is still going on. They are not even washing hands because even they do not have access to water to wash hands. They do not have money to buy soap to wash hands, and government has not done enough to provide them with those social amenities.
The virus has claimed to over 3,000 in the country, which has alarmed the government to quick order the COVAX vaccine. The acquiring of the vaccine was clouded by scandal just to pinpoint KEMSA and actors of COVID billionaires. This initiated in Kenyans the questions of true facts behind the acquisitions of such vaccines and their distribution to various regions. Over 1 million Kenyans have been vaccinated with the effort of the government to curb the virus in most regions, experiencing setbacks of adherence to some of the guidelines by the Ministry of Health.
We have seen some private citizens coming up, smuggling into this country some vaccines that had not been approved by KEMSA and KEMRI, that is Sputnik, and they were selling it at an exorbitant prices just to milk Kenyans, taking advantage of Kenyans who are already suffering, milking them down of their hard-earned cash.
Alarm has raised warning for the fourth wave of this virus across to the country's regions, and this calls for undivided support of the citizens to the government initiative to prevent the severe spread of this virus. As per the expert, help us to understand how best to improve the measure moving forward.
The government could have gone further and do an antibody test to determine the spread of this virus, because we do not understand, as far as today, we do not understand the spread of this virus. So if it could have come up with antibody study to determine whether people have ever been exposed to COVID, and after exposure, do they have antibodies to protect them against COVID? And if they have antibodies, how long are these antibodies going to stay in their body? So we need a lot of research around that area so that we can have strong, feasible measures to protect our country against the menace of COVID.
Following the upsurge of the infected people in the western regions of the country, different questions have been asked concerning the fight against this virus. As Kenyans who understands of what the government has not done right to secure its citizens from the respiratory communicable infection.